Hello guys, welcome to my channel Clinically Clear. Let's get straight to the point. Today we'll be covering the anatomy of nose. So first, let's look at the external nose. What all do we have? Let's look at some anatomical landmarks. First we have the glabella. This is the glabella. This is the nasion. As you can see in the picture, glabella, nasion. Then you have the long dorsum of the nose. You have two alar grooves. These are the alar grooves. You have a columella. This column here between your two nostrils is your columella. Below that you have a ridge below your nose all the way to your lips. This is known as the philtrum. And you have two anterior nasal apertures, also known as nares or nostrils. Now let's look at the parts of the external nose. The external nose is an upward directed pyramid. It is an upward directed pyramid. It mainly contains three parts. An osteocartilaginous framework, which is basically a mix of bone and cartilage, giving it a structure. Nasal musculature, which helps in movements of the tip of the nose, like flaring of your nostrils, and the nasal skin. Now, the nasal skin over the bony part of your nose, that is the upper part of your nose, is thin and loosely attached. You can try pulling it. Whereas over the cartilaginous part of your nose, it is thick and firmly attached. Now let's come to the bony and the cartilaginous framework. Two parts, the bony part and the cartilaginous part. Now, the upper 1/3 is the bony part, whereas the lower 2/3 is the cartilaginous part. Now, the bony part is mainly comprised of two nasal bones joined by internasal sutures. I'll show you in the picture here. Two nasal bones joined by internasal sutures. And superiorly, it is attached to the nasal process of the frontal bone. The nasal process of the frontal bone, whereas inferiorly, you can see here the frontal process of the maxillary bone. So nasal process of the frontal bone and frontal process of the maxillary bone are the superior and the inferior attachments of the bony part of external nose. Whereas the cartilaginous part, mainly you have three cartilages: the upper lateral cartilage, the lower lateral cartilage, and in some individuals an accessory cartilage, also known as sesamoid cartilage or lesser alar cartilage. Now, the lower lateral cartilage is also known as alar cartilage. So as you can see here, you have the upper lateral cartilage, the lower lateral cartilage, and in some individuals an alar cartilage. Then in the midline you also have a septal cartilage. So upper lateral, lower lateral, sesamoid cartilage seen in some individuals, lower lateral also known as alar, sesamoid also known as accessory alar, and a septal cartilage in the midline. Now the septal cartilage in the midline acts as an attachment for all these other lateral cartilages, the upper lateral and the lower lateral cartilage. They attach along the midline at the septal cartilage as a fusion point. Now, one very important thing to remember here is the lower lateral cartilage on the medial part is inferiorly longer, whereas on the lateral part is shorter. The remaining gap is filled by the fibrofatty tissue. So if we look at this angle towards your nostril in this angle, then you can see that the medial crus of this lower lateral cartilage is much longer. Why? Because this lower lateral cartilage is longer in the medial side, whereas on the lateral side it is shorter. So the lateral crus is much less prominent compared to the medial crus. And the midline you have the septal cartilage. And as you can see on the lateral side, in some individuals you have the sesamoid cartilage or the accessory alar cartilage or the lesser alar cartilage, and the remaining gap is filled by the fibrous tissue. This is the external nasal valve. Okay. Now there is a Now, nasal valve. What is nasal valve? Whenever we think of valve, it is something that regulates airflow and currents. There are two nasal valves, that is the external nasal valve and the internal nasal valve. The external nasal valve is nothing but the nostril, and the external nasal valve is nothing but this diagram right here. It is comprised of the medial crust of the lower lateral cartilage, the septal cartilage, the lateral crust of the septal cartilage, in some individuals accessory alar cartilage, and fibrofatty tissue. So this nostril, by flaring the nostril, you can regulate the airflow. This is external nasal valve. But more important is the internal nasal valve, or also known as the Lyman nasi. Now, what is this internal nasal valve? Very important. The least cross-sectional area in the nasal cavity is at the region of internal nasal valve, also known as Lyman nasi. So you can see here, this part here in the nasal cavity, you have the least cross-sectional area. So let's look at the boundaries. Commonly asked 3 marks question, nasal valve. Medially, you have the nasal septum. Laterally, you have 3 components. You have the lower border of the upper lateral cartilage, you have fibrofatty tissue, and you have the inferior turbinate. And floor, you have the nasal floor, nothing but the floor of the nasal cavity. So think about it in this direction. Medially, you have the nasal septum. Laterally, you first have the lower border of the upper lateral cartilage and the fibrofatty tissue, and inside you have the inferior turbinate, and you have the floor of the nasal cavity. This is the boundaries of the internal nasal valve, also known as Lyman nasi, which is the narrowest part of the nasal cavity. Then let's come to the clinical aspect of this nasal valve. Whenever there is some obstruction towards one side, DNS, example deviated nasal septum, what happens? There is narrowing of this already narrow nasal valve. Nasal valve is already very narrow. So when there is further narrowing, there is difficulty in breathing. How do we check if there is an obstruction at the level of nasal valve? It is by a test known as Cottel's test. By pulling your cheek laterally, what happens is that the lateral wall of nose, including these lower lateral cartilage, upper lateral cartilage, they're all pulled laterally. So think about it, when these get pulled, when the lateral wall of the nasal valve gets pulled laterally, the space increases. The space inside this nasal cavity at the level of nasal valve increases. So because of this, what happens? The breathing suddenly improves. The patient suddenly feels like he's able to breathe much better. So this is Cottel's test positive. Understood? This is the clinical aspect. So this is about external nasal anatomy of external nose. Shortly I'll be releasing another video for anatomy of internal nose as well. Please stay tuned, like, share, subscribe if you enjoyed the video, and thank you for watching.